Bleomycin Sulfate Vial is a medication used to treat cancer by slowing or stopping the growth of cancer cells. It may also be used to control the buildup of fluid around the lungs caused by tumors that have spread to the lungs. In this case, the medication is placed in the space around the lungs through a chest tube. It is important to follow the dosage and timing prescribed by your doctor for the best results. Always consult with your healthcare provider for the optimal timing to take this medication. This medication is usually given by injection into a vein, muscle, or under the skin by a healthcare professional. Your doctor will give you specific instructions on how often you should receive the medication. If given into a vein, it is injected slowly over 10 minutes. Let your healthcare professional know if you experience any chest pain. The dosage is determined by your medical condition, body size, and response to treatment. If you are receiving this medication through a chest tube into the space around the lungs, the solution is usually left in place for 4 hours and then drained out through the chest tube. Your doctor may instruct you to change positions during the 4 hours to ensure the solution treats all parts of your lungs. Some common side effects of bleomycin sulfate vial include pain/redness at the injection site, fever, chills, vomiting, loss of appetite, weight loss, darkening of the skin, changes in fingernails/toenails, and temporary hair loss. It is important to tell your doctor if any of these effects last or get worse. Additionally, painful sores on the lips, mouth, and throat may occur, and you can decrease the risk by limiting hot foods and drinks, brushing your teeth carefully, avoiding mouthwash that contains alcohol, and rinsing your mouth often with cool water. Bleomycin can also cause skin reactions, usually in the 2nd or 3rd week of treatment. It is essential to tell your doctor right away if you develop any skin reaction. Serious side effects may include nausea that doesn't stop, dizziness/fainting, fast/pounding heartbeat, numbness/tingling, feeling of coldness in hands/feet, easy bruising/bleeding, pale/bluish skin, coughing up blood, vomit that looks bloody or like coffee grounds, signs of infection, signs of kidney problems, mental/mood changes, stomach/abdominal pain, dark urine, yellowing eyes/skin, weakness on one side of the body, vision changes, trouble speaking, or chest pain. It is important to seek medical help right away if you have any very serious side effects or notice any symptoms of a serious allergic reaction. If you notice any other effects not listed above, it is important to contact your doctor or pharmacist. In rare cases, bleomycin may cause a serious allergic-like reaction, especially in lymphoma patients. Before starting the main treatment, your doctor may have you receive a small test dose to check for signs of this serious reaction. If you experience any serious side effects such as dizziness, fainting, confusion, fever, chills, or trouble breathing, be sure to inform your doctor immediately. Severe lung problems, including lung scarring, have rarely occurred in patients using this drug, with older patients over 70 being at a higher risk. The likelihood of this reaction increases with each dose of the drug and may occur at any time during treatment. If you experience symptoms such as cough, fever, chills, chest pain, or difficult/painful breathing, it's important to notify your doctor right away. Before starting bleomycin, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to this medication. It's important to discuss any inactive ingredients that may cause allergic reactions. Before using this medication, share your medical history with your doctor or pharmacist, especially if you have immune system problems, kidney or liver disease, or lung issues. It's important to note that this medication may increase sensitivity to oxygen treatment, so be sure to inform your healthcare provider before any surgery or treatment involving oxygen. Older adults may be more susceptible to side effects, so it's essential to communicate with your doctor about any concerns. If you are pregnant or planning to become pregnant, it's crucial to discuss the risks and benefits of using bleomycin with your doctor. This medication may harm an unborn baby, so it's essential to seek medical advice immediately if you become pregnant while using bleomycin. For breastfeeding mothers, it's important to consult with your doctor before using this medication, as it is unknown if the drug passes into breast milk and may pose a risk to the infant. It's important to be aware of potential drug interactions that could affect how bleomycin sulfate vial works or increase the risk of serious side effects. This is not an exhaustive list, so it's essential to keep your doctor informed about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication without consulting your doctor first. Some products that may interact with bleomycin sulfate vial include brentuximab, digoxin, and drugs that may harm the kidneys, such as aminoglycosides like gentamicin and cisplatin, as well as phenytoin. Be sure to discuss any concerns with your healthcare provider to ensure the safe and effective use of this medication. If someone has taken too much bleomycin sulfate vial and experiences severe symptoms like passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contacting a poison control center is necessary. U.S. residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. During your treatment with bleomycin sulfate vial, your doctor may require you to undergo lab and/or medical tests, such as chest X-rays, complete blood counts, and kidney/liver function tests. It is important to attend all scheduled medical and lab appointments. Please consult with your doctor for more details. Make sure to take each dose of bleomycin sulfate vial as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule as soon as possible. This medication is typically given by injection into a vein or muscle, as directed by your healthcare professional. The dosage is based on your medical condition, weight, and response to treatment. Be sure to follow your doctor's instructions carefully. As for the best time to take this medication, it is best to follow the schedule provided by your doctor or pharmacist. This medication is typically administered by a healthcare professional in a hospital or clinic setting and is not meant to be stored or used at home. It is used to treat various types of cancer, including Hodgkin's disease, non-Hodgkin's lymphoma, and testicular cancer. The dosage and frequency of administration will be determined by your healthcare provider based on your specific condition and medical history. It is important to follow their instructions carefully. This medication is usually given through a vein, intravenously, or injected into a muscle, intramuscularly. It is important to receive this medication at the scheduled times as directed by your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.